Okay, so we'll get going in a minute for those that have just joined us. Okay, so it's 6 o'clock now, so I'd like to welcome you to this evening's Fertility Network UK webinar, Know Your Rights, Fertility Patients Information Webinar with Pohwer. So thank you for joining us tonight. I'm Jenny from Fertility Network UK, and I work as the Ethnic Minorities Community Project Worker. I'm delighted to be joined by guest speakers from Pohwer, Penny Bodger-Yates and Rose Humphreys. So tonight we have an empowering webinar for you providing information on patient and self-advocacy tips and resources. This webinar is suitable for both past and current NHS or private fertility patients. If you have experienced poor experiences in your fertility care and treatment. So just a bit of background, as highlighted in the HFEA Ethnic Diversity in Fertility Treatment Report 2021, ethnic minority people experience poorer outcomes and experiences in fertility treatment. So we want to show you what support is available and for you to find out what your rights are if you or a loved one are going through difficulties and the strain of dealing with poor fertility treatment. So now I'm delighted to welcome our guest speakers, Penny Bodger-Yates and Rose Humphreys from Pohwer. Thank you, and over to you.
Thank you very much. Hello, everybody. I'm going to start. My name is Rose Humphreys, and it's really good to be with you this evening with my colleague Penny. We're going to be talking to you tonight and sharing some information with you about a service that we provide to support NHS complaints, and it's our NHS Complaints Advocacy Service. We both work for an organisation called Pohwer, which is a charity who provide advocacy services across the country. Thanks, Penny. So by way of an introduction then, the NHS Complaints Advocacy Service is enshrined in law. So the Health and Social Care Act 2012 transferred the NHS Complaints Advocacy from the Department of Health, who initially were responsible for it, commissioning it, to the local authority commissioning from the 1st of April 2013. So this means that since April 2013, statutory duty is on all local authorities to provide a free, independent and confidential advocacy service to anyone who wishes to make a complaint about their NHS care or treatment using the NHS complaints procedure. 37 local authorities across England have contracted Pohwer to provide this service to its residents. So we work in many local authorities across the country, but not all of them. So there are other providers that provide this advocacy service in other areas. Thanks, Penny.
Thank you, Rose. So I'm going to talk to you a little bit about how the process works and the support that an advocate can offer to you. So many of our complainants will approach Pohwer through our help hub. So that's the National Help Hub. We can be approached by telephone calls, emails, good old-fashioned letter, and our help hub will have a look at that request and see if it's just a request for information. If, as Rose mentioned, the person lives in an area where Pohwer do not provide the NHS Complaints Advocacy Service, then we would signpost to the local provider. But if somebody is in one of our areas, we would send them out a self-help information pack, a SHIP pack. So that's got details of template letters, some guidance on navigating the NHS complaints process. But if somebody needs more intensive support, then they would be assigned an advocate that is local to their area. So they have the expertise and knowledge of the services in that area. That's done within 5 working days, and the advocate would contact the individual to establish the support that's needed. So how can we help? So initially, the advocate would have a conversation which can last anything from half an hour to a couple of hours, depending on the complexity of the complaint. The advocate would establish what measures and actions the complainant had taken so far. Once we've done that, we'd be able to see what additional support the advocate could bring to that person and to the process. So one of the things we might do is help with writing letters. So this may be as simple as actually finding the name and address of who to write to. I think we're all aware of how complicated the NHS provision is. And just because you've had a service delivered at a certain hospital doesn't necessarily mean that's the person who's run the service. So we'd help you find out who to write to. We can help people write those letters. As I say, we'd establish the details of the complaint and help put a letter together for the individual. But all the time we're trying to empower the individual to do as much as they can for themselves. With regard to the letter writing, we would never put our advice in that or our thoughts. We put down and voice in your concerns about your complaint. It might be that you're quite happy to write the letter yourself. If this is the case, you can just send that to the advocate. If you want them to have a little read over it, just to make sure that you haven't missed anything you may have mentioned to them when discussing the complaint. And then it would be down to the complainant, in most cases, to send that letter into the service provider. The template letters in our self-help information packs give guidance on the sort of things to include, an overview maybe of the history and the background to your complaint. We do always encourage people to put anything positive in that complaint letter. So when things went well as talking about what didn't go quite so well or didn't go to meet your expectations or something that went very wrong. This just gives a balanced overall view of your complaint. We can also help prepare for LRMs, it says there, the 3-word acronym, local resolution meetings. So should you be offered a meeting with the service provider, we can help you prepare for that meeting before you go, and we can also support you at that meeting. Sometimes people feel that just having somebody by their side for the meeting makes them stronger to actually get their own words out and their own feelings about the complaint. So we can do, as I say, just prepare or support you at that meeting. We can talk to the NHS staff about current care and treatment. We aren't able to get you up the waiting list or any of that sort of thing, but we can have discussions on your behalf. Help you to obtain medical records. We can answer questions about the complaint process and explain to you your options, and says here support at any stage of the complaint process. So again, on the first conversation that the advocate has with a complainant, we'd be establishing what you've done so far, because the complaint process itself follows a certain process. So what outcomes can be achieved? So the things that you can ask for as in a complaint is an apology. You could ask for an explanation of why things happened, an apology for something that went wrong. You might ask that there's a change in policies or procedures, and this is to try and gain assurance that the changes will occur, so somebody else wouldn't have the same negative experience that you've gone through. Access to treatment sought, what that means is that if you feel you're entitled to treatment, you can ask for that treatment. And financial reimbursement, that is not compensation, but just to give you some examples actually of all of those. The financial reimbursement, sometimes called financial remedy. For example, if I was admitted to hospital very poorly, all my jewellery's taken off me, and I get a bag handed back on my discharge and my diamond earrings are missing, I would be able to ask for financial reimbursement to replace those. Some of the other examples, explanations and apologies and changing process. Couple of the outcomes that we've seen. Somebody, this sounds a very simplistic complaint, but a GP surgery had spent a lot of money on some new furniture for their swanky new reception area, but unfortunately one size chair does not fit all, and so a number of the patients actually complained about the chairs, and in time, these were replaced by different height chairs, different comfort chairs, different types of chair. So the majority of the people visiting the reception area could be accommodated. We've also had somebody complain about going to an eye clinic. They have poor sight. There was no leaflets in large print. Again, it seems very simple to resolve. But until the patient had actually made the complaint, there was no large print leaflets in the eye clinic, and there now is, I'm pleased to say. So there's some examples of the outcomes that could be achieved. So what an NHS complaint advocate cannot help with is any legal matters or give legal or medical advice. So advocates are trained as advocates and not medically or legally trained. We don't actually investigate the complaint ourselves. All we do is help the complainant with the process to navigate that process and maybe chase things up on their behalf, but we don't investigate ourselves. That is down to the service provider to organise that. We can't help with getting compensation. As I just mentioned, we can help with requesting financial redress, but that is just to refund you for any loss, or maybe you lost your glasses when you were in hospital, or they were lost, or slippers went missing, that sort of thing. So that's very different to compensation. If complaints are over 12 months old from when you first became aware that there was an issue, you can still put that complaint in. However, the NHS complaints process does stipulate that service providers are not obliged to respond to those. So we always encourage people to, if they have got a complaint, to raise that as soon as they're aware. And we cannot help with anything that is outside of NHS funded services. So General Medical Council, Nursing and Midwifery Council applications. And we do not provide a secretarial service. So whilst we might help write letters, we are not there to do that completely for a complainant, and we don't sit and take notes at a meeting. We're there in a supportive nature. Okay, so who can we work with? Well, we work with anyone. So you can complain on behalf of yourself, so something where you feel that you haven't got the service and treatment that you felt was appropriate or required. You can also complain on behalf of a relative, even if they're deceased, a carer, a PA, or the referral might come from a third party. Just to clarify about those points, it may be that if you have consent, that's great. If you don't have consent, you can still complain about something on behalf of another, but there may be limited information that you would get back from the service provider. You might get a more overview sort of feedback. So we work with people with mental health issues, with the learning difficulties, with sensory disabilities, people from all cultures, all backgrounds. And as we've mentioned earlier about, we can support if there's issues regarding a deceased person, then obviously we support people who are going through bereavement or in distress because something, some care and treatment has not worked out as expected. If we're supporting people who have little or no English and need an interpreter, then we can arrange for that. So there should be no barriers to accessing our service. Okay, so we have access to the British Sign Language signers, medical, sorry, I can never pronounce this, medico-legal advice services. So that might be AVMAR or Citizens Advice Bureau and other legal services. Information, we try and provide that in the format that is required for our complainants. So that might be different formats, different language, and that can include large print, easy read versions, audio and video formats, amongst a lot of the communication toolkits and training that our advocates have. We have access to meeting rooms, so we will do a lot of NHS complaints support via telephone. We can do that via video calls. We can also meet clients in local cafes if they would be more comfortable. And where we can't arrange any of that, we would meet clients in their own home if we couldn't find a neutral venue. Over to you, Rose.
Thank you. Okay, so we also work to support people to proceed along the right path with regards to the concern that they present us with at the time that they contact us. So PALS stands for the Patient Advice and Liaison Service, and most NHS hospital trusts will have a PALS service or a patient support service on site to help people whilst they are in receipt of NHS care and treatment. So it's important for us to make it clear how we work alongside PALS. So PALS and independent advocacy. So with the role of the Patient Advice and Liaison Service actually being on site day to day, there and available, if the problem needs sorting now, if it's something that somebody is raising a concern whilst they're on a ward or whilst they're visiting as an outpatient, then their first port of call in that instant should be to reach out to the local PALS, speak to PALS, find out where that PALS office, or ask a member of staff to put you in contact with a PALS officer on site who should be able to help you there and then. If you want a copy of your medical records, then the way to gain that is through a subject access request. And our advocacy support officers and our advocates can support you with making that subject access request. And there's also information within our self-help guides that show you how you can do that. Okay. If you don't want what's happened to you or your loved one or a friend to happen to anyone else, then we would support you to make a complaint. And I think that is the most appropriate thing. If you want to make changes and you want the experience that you've had not to happen to anybody else, and you want the NHS staff to learn from your experience, then the best way to do that is by making a complaint. And nobody should feel concerned about making a complaint. It should not have any impact on your current or future care and treatment. I need an appointment rearranging. Again, making a complaint can be a lengthy process, so it's probably not the best way to take that forward. Again, we would suggest that you speak to PALS or you speak directly to your local GP surgery if it's to do with primary care. Systems in the hospital need changing. You might have had an experience in hospital or on an outpatient's visit that just didn't feel right or impacted on a lot of people, impacted on yourself and your time. and you want to share that because you think something could be done to make it better for either yourself or for other people attending in the future. In those incidents, again, we would suggest you make a complaint so that that learning can be taken on board and systems and processes can be considered and changed to make that a more appropriate environment and system for the people that are using the services. Very often NHS staff are very, very busy. They go through the day and they don't realise the impact some of their systems might be having on individuals until we raise that with them. And the best way to raise that with them to get answers and to get changes is by making a complaint. And the issue cannot be resolved by PALS at that time. They might have put something in place to help at that moment, but once you're through that and you're back home or later on, you might be thinking, yes, okay, they sorted it there and then, but I'm still not happy with how that went. I still want more answers, or I still want things to change. I want them to realise the impact that that had on me, even though they tried to sort it then. Again, we would suggest that you make a complaint in those incidences. Okay, thanks, Penny. Okay.
I think this is, oh, there we go.
I think we've jumped one, but that's okay.
Oh, I beg your pardon,
this is,
sorry. No, that's fine. Gone back.
Oh no, that's probably, no, there you go, there you go. Just wanted to give you a little bit of an overview of the number of people that we support, because you might be sitting there thinking, oh, nobody wants, you know, little me, who's going to listen to me? You know, I'm probably one of a few that would raise, you know, want to raise any issues. I don't really have a voice in this. But I think it's really important that we share the number of people that we support through our advocacy services through a year. So these numbers are from the year 2022-23, and you can see there through our advocacy services, the number of people supported was 156,405. So it's a substantial number of people that come forward and request support through our services. We supported 101,736 people challenges and supported issues. So taking those challenges forwards, 68,384 new people were supported during that year, and 88,019 existing people were supported during that year. At that moment, I think we've got more now, but during that year we had 349 advocacy staff and 81 volunteers supporting our teams. And again, through our information and advice, we supported 367,873 calls, texts and emails handled by our help hubs. So our advocacy support officers are online from 8 AM in the morning till 10 PM in the evening, Monday to Friday, and they are there to take those calls and answer those emails and support people where they can in signposting and advice. 6,088 people supported with basic needs, including food, parcels, utilities and white goods services. We have 46 information and advice staff supporting our advocacy teams. And looking at the feedback that we get for our support and our services, and looking at how we manage and report on quality and risk of advocacy services, 93% of our service users, beneficiaries that used our service, rated our services a 5 out of 5, which is absolutely fantastic for our organisation, our charity. And during that time, we supported 966 safeguarding alerts to local authorities. So this is where we are presented with people who are at risk, who are suffering real hardship. And it's our role to raise those safeguarding alerts to the local authority so that they can be supported in those situations. Okay, thanks, Penny. So thinking about the people that we support through our advocacy services, we do not have a typical beneficiary. Okay, so as you can see from the slide, I won't go through it in detail. You can look at this in your own time, but I'll pick 2 or 3 out of sort of percentages there. So when we're looking at the people that we're supporting through our advocacy services, within that same year, 22-23, you can see there that 43% live with a mental health condition, 52% live with impairment or disability. 85% have reported to us that they have a religion or faith, and 35% of the people we support identify as Black, Asian, or come from another minority ethnic community. So there's quite a varied picture there of the different people that we support in different communities all across the country. Okay, thank you. I'll pass over to Penny and she'll talk about how to contact. Thanks.
Hi again. So you can contact Pohwer through our telephone line. This is charged at local rate. You can email us on nhscomplaints@pohwer.net, or the good old-fashioned postal service. You can write to us at Pohwer, PO Box 17943 Birmingham, B99PB, and our website is www.pohwer.net. And we've got a wealth of information on the website. Not only have we got the details regarding how to contact us, how to raise a complaint, there's also a lot of our self-help information is there. So if you wish to make a complaint and you'd like to have a go at doing that, and you feel you don't need any support, or you've got a support mechanism around you personally, then the information is there. And as always, should you need our help after you've started that process, or you're partway through the process, then please do get in touch, because we're here to help. So we also have the QR code there. So if you are interested in keeping up to date with what Pohwer's doing, our work, how to get involved, latest news about our events and campaign, then you can either look at that on our website, or you can just scan this QR code. And that's the end of our presentation. Thank you very much, all of you, for taking the time to listen to us. We're now happy to take any questions.
Thank you so much for that really helpful and thorough presentation, Penny and Rose. Just for our attendees to be aware that the webinar is being recorded and it will be available on our website, and that's also via our YouTube channel within the next couple of weeks. So as Penny and Rose mentioned, now's the time to ask any questions or share any reflections, and they'll try best as they can to answer any questions that you have. All our webinars are free, but we are a small charity and we rely on donations. So if you feel able to make a small donation to help us to put on these webinars, we'd be really grateful. You can text to donate by texting FNUK and the amount that you want to donate to 70085. So for a one-off donation of £5, you can text FNUK5 to 70085, or to donate £3, you could text FNUK3 to 70085. So feel free to unmute yourselves or pop any questions in the chat. I'll hand back over to Penny and Rose.
Thank you, Jenny.
And I can see a question that's come up in the Q&A section. So the person would like to know, what are some of the most fertility-related complaints and issues you've observed recently?
That's a really good question. Very good question. We did actually go out to the team, but I think we've been a little bit late going out to teams to ask. So we don't have any examples ourselves that we can share right now, but I am pretty sure that we will have some across the advocacy teams. So it's very difficult for us to give us a specific example right now. but I'm sure we could share some with you through case studies once we get some more information from the teams.
Okay, thank you for that. And some people who are watching the webinar may have complaints regarding privately funded fertility treatment, so not necessarily NHS funded services. So other than complaining to the healthcare providers directly, what advice or where can you signpost them to? Because many fertility patients unfortunately won't be able to access treatment via the NHS.
Yeah, unfortunately, we would be signposting them back to the service provider, and we're unable to support with those, I'm afraid.
Mm.
Yeah. Mm-hmm.
Yeah, but the self-help tools on our website are available to anybody. So please use the template letters for any letters that you want to send to anybody, really, with regards to care and treatment. But the service that we provide, the advocacy service we provide, is for NHS funded care and treatment. So if you're using a private provider and you've had NHS funding, then we would be able to support. But if it's private healthcare funded, then we're not able to provide the advocacy support. But there's, the self-help tools are there for anybody to use at any point.
So that sounds like a great starting point in terms of, the tools, if they did have a complaint that was directed to a private healthcare provider, and then people may want to look up the independent sector's complaints adjudication service in regards to directing complaints towards their private healthcare provider during their fertility journey. So there might be some more information available that you can access if you are in that situation.
And also the PHSO website has some useful information regarding complaint standards. So Pohwer, 2 years ago now, was helping support the development of the complaint standard framework. So this is a framework that service providers opt to sign up for as to how they will conduct the complaints process. So that is really helpful about communication, what communication to expect, time limits, that sort of thing. So again, along with the self-help tools that Rose mentioned, that's just more information to help you make a more informed complaint.
Okay. Thanks for that. So we've had another question come through. What advice would you give for advocating for yourself, especially in terms of being assertive while navigating the complexities of the NHS? That's a very good question.
Yes. I would say be kind and remember that you're dealing with people who didn't set out to do a bad job. I know it can be frustrating and upsetting when things don't go to plan, but try and yes, be kind in your communication, but also be succinct in that. And again, I mentioned earlier, making sure that you give a balanced complaint. So was there something that went well, or somebody that did a good job, supported you, even if a different part of your experience was not so good? Rose, have you got anything to add?
Yeah, and I would say be specific in what you want to gain from putting forward your complaint. Be clear about any questions that you want to ask. Give factual information and as much detail as you can with regards to the situation that you were in. If you've got names that you can add to complaint letters of key staff that were involved, then you're absolutely right to do so. And yeah, really specific about the questions that you want answers and the explanations for certain experiences that you had and certain decision making maybe that was made at a time. If you want an explanation as to why that decision was made and you're not happy with that, put it really clearly. Yeah, put it across really clearly with what you would like to gain from making your complaint as well. I think that that's really quite important from the start, to make that clear at the beginning when you're putting your complaint in.
It's
But
really
be confident.
interesting.
You have a right. Sorry, Penny.
No, go on.
You have a right to complain about NHS care and treatment. It's legal. It's the law. Everybody has the right, and that's why we support anybody. There's no eligibility criteria other than being somebody who has used the services of the NHS. So you have a right to complain. You have a right to share your experiences. You have a right to gain a response. And you know, you can go a long way in doing that. You can go a long way to make changes and make things different for the future. So it's an important step to make. Sorry, Penny, interrupted you.
I was just going to say the feedback we get from service providers when they receive a letter, they often know without actually looking at the CC My NHS Advocate in that it's been provided, the template's been provided by Pohwer, because that information and the hints and tips within that template about what to include, as Rose was saying, it really does help the person who's dealing with your complaint understand what's happened and what it is you want an explanation about or an apology about, and being clear about what outcome you want from making the complaint is really key. So yes, would encourage you to have a look at those if you are in that situation where you're currently wishing to make a complaint.
And I just wanted to add that anybody in this situation or a loved one in the situation may have experienced some traumatic experiences in regards to their care and treatment. So also about being kind to themselves and seeking support, you know, whether that may be counselling or we also have obviously support groups that people can access. And so, you know, you may find that you're not alone in what you've experienced. So just having that emotional support is also key to self-advocacy, which can really take a toll on individuals in that situation.
Absolutely, yes.
Yeah, and like Penny said earlier, you can contact us at any point. So you might have been really quite confident in putting the words on the paper, in writing that. It can be quite therapeutic to write a letter of complaint, to get those words down. But then further along, you might feel quite anxious about going along to a meeting with NHS professionals. And you might want some support around preparing for that, or somebody there with you, somebody independent that can support you through that process. You can contact us at that point if that is the support that you need from the advocacy service. So we can come dip in and out as needed to support you at different points as you take that complaint through the complaints process. Okay.
Great, thank
you. Sorry, just going to add to that. If you are at that point, Rose has just described in the process, please contact us as soon as you can. The advocate would benefit from being able to read any correspondence that's gone before the meeting, would welcome time to be able to talk to you and really thoroughly prepare you for that meeting. So if you do have something coming up that you do wish an advocate to be there, do contact us at your earliest opportunity.
We've got a couple more questions. So we highlighted that the outcomes and experiences for people from ethnic minority backgrounds are poorer, particularly in fertility care and treatment. So what would you say your observations are of some of the issues and barriers regarding raising complaints within these communities?
I think there are a number of communities where they're not comfortable raising complaints, putting the head above the parapet, or it's not the done thing in those communities, or different cultures. They try and people will try and support each other but that may not get the outcome. It's great to have that support around the individual, but that may not be able to affect change. Rose?
I agree, and I think sometimes when you've experienced poor care and treatment, I think it takes a lot of courage to then go forward and put a complaint in as an individual who's experienced poor care and treatment, or been treated, you know, not as you'd like to be treated, or not as you should be treated. So, and I think that can impact lots of people in lots of different ways. And I think having somebody there with you to support you through that, I think is really, really quite important. And also being reassured that will not affect your ongoing care and treatment. We do hear this quite a lot from people who are really worried about raising formal complaints, taking a complaint forward formally, because of they're worried about the repercussions of doing so, and how NHS staff might treat them as a result of them raising the complaint. And I think as long as that is done appropriately, you have a right to raise a complaint, you have a right to share your experiences. And as Penny used the word, be kind, even if you are complaining. And I think if you do that, and if you know, your communication through your complaint is kind, and it puts things across factually, or points across factually, then there is no reason for that to impact on your ongoing care and treatment. But I do know that people do worry about that. Okay, and all we can do is try to reassure people and empower them to take that forward if that's what they wish to do. Okay.
It's very common that people from ethnic minority communities will report of gaslighting, or you know, having their concerns dismissed, and so that then feeds into the difficulties around psychological safety of actually making complaints towards the NHS or private healthcare providers.
Yeah, when you have an advocate, they're often called a little terrier, because they will make sure that, or they'll do their best to make sure you get a response, and they'll help chase those response, and to do their best to make sure that that service provider is appropriate in their dealings with you, their communication, remind them of their commitment to the complaints process. So even if a reply can't be delivered within the timescales, they should communicate that to you. They should be mindful if they have a meeting with you about making that an environment that is going to get the best out of that meeting, and having the appropriate people there to support you and have an understanding of what you've been through. So as I say, everybody can get the best out of that meeting.
Thank you so much. Just got time for one more question. You mentioned about the fantastic resources and tools available on your website, but also was wondering if you could say a bit about what does best practice look like in respect of addressing complaints?
You happy for me to go? So with regard to the process, if I just very quickly, and I realised when I was talking through the slides actually that the process wasn't really explained, so I need to make a note to maybe expand on that a little bit. So if we start just a quick run through, so somebody has a negative experience, comes to Pohwer, would like support of an advocate. So there would be usually an initial discussion takes place about the background, what's happened, the key points and the outcome they would like to achieve. That is usually communicated by a letter to the service provider, who should acknowledge within, I think it's 5 working days, they should acknowledge receipt of that complaint. And then following that, quite soon after that, they should give an indication of how quickly one should expect a response to that complaint. Now, depending on the nature of the complaint, the complexities, how old the complaint is, and while we've said it can't go back more than 12 months from becoming aware, if it is something that staff have moved on, or there's been changes in service, it might take longer to address and respond to that complaint. So we would ask that the complaints advocacy team keep the complainant briefed on when they can expect a response. Usually that response is given, and we're talking between 30 and 90 days is kind of what I would say is normal. People are quite shocked when we say that, but that is kind of normal response times. So a response would usually be given with a letter, and if the complainant is not happy with the outcome and the apology or explanation, for example, that's given in that letter, then they may request what we refer to as a local resolution meeting. So that is going and discussing any outstanding points and sitting around the table with those with the representatives of the service provider, and sitting there with their advocate if they would like one to support them at that meeting, and just to go through those details. And quite often just having professionals take the time to sit and talk with the complainant means the world to them. And you know, we talk about looking somebody in the eyes and, you know, and having that apology directly to you, so it feels meaningful, and trying to be reassured face to face that your complaint will make a difference and it won't happen again. And people often find that, I was going to use the word therapeutic, but just the outcome of that is people feel heard, they feel listened to, and it is much more meaningful for people to have that meeting. Quite often, where we've had a local resolution meeting, the complaint is closed at that point, because people feel that even if the answer is maybe not what they wanted, they couldn't get the outcome they wanted, they usually gain a much better understanding through that face-to-face meeting. However, if they're still not happy, then there is the option to go to the Parliamentary Health Service Ombudsman to have that complaint reviewed. Now, they will always ask if local resolution has been exhausted. So that is kind of the first stage of the letter, the second stage of that meeting. Depending on the circumstances, not very often, but sometimes the service provider might decline that face-to-face meeting, but they would explain why. But once the service provider has done as much as they feel they can, they would write in the response letter to the complainant that there is nothing further that they would do, and the next stage for a complainant would be to go to the PHSO. We can support put an application into the PHSO, and again, they've got really useful, easy to read, non-flowery language help and advice, and an overview of what they would do, the PHSO would do once the complaint goes to them. They are absolutely inundated with complaints, and they have started to look at complaints and choose to take some complaints forward, and some won't be taken forward, but we can support through that process. But once there's been a response from the PHSO, then that would be the end of the process. But we can support all the way through that. And as Rose mentioned earlier, you can come to us at any stage and we can just get involved at that point.
And it's really important to note as well that you can stop it at any point too.
Yes.
You don't have to continue with your complaint if you don't want to. If you don't feel you're getting anything by taking it further, you can stop that process at any point. It's really important that you have ownership of your complaint, even though you might be supported by an advocate. It's your complaint, your words, and you decide how far you want to take that and what questions you want to ask, and when you've received the response that you were looking for, or when you feel that you can't take it any further, then it's your decision to stop. And it's important that that is discussed as one of the options throughout the process.
Yeah. Interestingly, on that note, an example I can share is where a family, they'd lost dad. He died in hospital, and the wife was still alive and wasn't happy with the care and treatment that had happened to her husband. Started the process, but then felt unable to carry on and didn't think it was worth it. But the children, grown-up children, really felt strongly that if they didn't complain, it could happen to somebody else. So they took on the complaint. So it may be that as you work through the process, how you're feeling about the complaint changes. So in this instance that I've just shared, then we were able to support the other family members to continue with that complaint. And we do hear about this when you've lost, particularly an elder relative, there is a difference of opinion of how much, whether it's worthwhile complaining, is it just prolonging the bereavement, or would it actually make a difference? And there's only the family themselves can decide that. But you know, we're happy to support and give those options and be truthful about what somebody might gain from making that complaint. And every circumstance is different, and again, we don't give advice, we just explain the options and what might be the outcomes.
That's all very useful information to know. And in regards to fertility patients, specifically, you know, if they are going through treatment or have been through treatment and had unsuccessful outcomes, you know, that would definitely be relevant, you know, where people may not want to proceed with their complaints, or have a loved one, you know, support them with a complaint due to the impact of being unsuccessful with treatment, or indeed the process itself. So it's been very helpful to hear about the different stages in a bit more detail, and also to be more aware of the communication methods and tools that are available, such as interpreters and BSL interpreters also. So really helping people to access information in a inclusive way. So thank you. So that's all that we've got time for tonight. We hope you gain some valuable insights and tips from tonight's webinars. We're looking forward to you joining us again for our next upcoming webinars. I want to say a big thank you to our wonderful speakers, Penny and Rose, for being with us here tonight and sharing information about Pohwer. If there's any resources, we can send them across to you, and also just for any private fertility patients, there will be a link to the service that you can contact regarding any complaints. Thank you all for joining us tonight. Please don't forget, we are your charity and we are here for you. So if you need support, we have groups across the country and some UK-wide groups, including a Black women's group, a South Asian group, and a Muslim women's group. And you can contact me, the FNUK, Ethnic Minorities Community Project Worker, anytime. Also, we have a support line and information line, which is open every weekday. So please don't hesitate to contact us. So once again, thank you so much for joining us, and we look forward to seeing you again soon. Thank you, Penny. Thank you, Rose.
Bye.
You're welcome. Bye-bye. Thank you.
Bye-bye.